For years, Big Pharma has used the phrase, trust the science, to sell their products and policies. But can we really trust science that isn't transparent? Science that's shielded from scrutiny, backed by billions in profits, and protected by an opaque regulatory system? What's worse, the very agencies meant to protect us, like the FDA, are funded by the same corporations they're supposed to regulate. And it's not just the FDA. The deeper we look, the more corruption we find, from Big Pharma to the FBI, and even the prosecutors involved in cases like Luigi's. Let's dive into how this system works and why it's failing us.
The FDA, Food and Drug Administration, was created to protect public health, ensuring that the food we eat and the medicines we take are safe. But today, the FDA relies heavily on funding from the pharmaceutical companies it regulates. Through the Prescription Drug User Fee Act, or PDUFA, Big Pharma pays massive fees to the FDA to speed up the approval process for their drugs. In 2023 alone, these fees accounted for over half of the FDA's budget for drug evaluation. Think about that. The regulator's survival depends on the very industry it's supposed to keep in check. According to the FDA's own budget report, over $4 billion in user fees were collected in recent years, a clear indicator of how intertwined the agency is with the industry. To the average person, this sounds a lot like bribery. A company pays the FDA, and in return, their product gets reviewed faster and often approved. But it's more than just the appearance of corruption. These payments create a system where the FDA prioritizes profits over public safety. Harmful drugs, from opioids to poorly tested medications, have been approved under this pay-to-play model, leading to countless deaths and suffering. The data, as reported by the CDC, confirms over 500,000 opioid-related deaths in the U.S. over 2 decades of crisis, fueled in part by FDA-approved products. This isn't just unethical, it's a direct violation of federal laws. The Ethics in Government Act, detailed in 5 CFR 2635, prohibits public officials from using their positions for private gain or creating even the appearance of favoritism, and federal bribery statutes under 18 U.S.C. 201,209 prohibit officials from accepting anything of value in exchange for influencing their duties. Yet, the FDA's financial dependence on Big Pharma flouts these principles and undermines its mission to serve the public good. For reference, these laws explicitly state that public trust cannot be subverted for personal or institutional gain. Yet here we are. When the FDA was created, it served a critical role in safeguarding the public from harmful products. Scandals like the sale of unregulated, dangerous medicines in the early 20th century made the agency essential. But today, with modern technology, independent researchers, and access to global information, we must ask, is the FDA in its current form still necessary? Or has it become a barrier to accountability and a tool for corporate profit? Resources like the National Archives detail the FDA's early mission and how far it has drifted from those ideals. The FDA isn't the only institution that's failed to protect public trust. The FBI has its own history of corruption and questionable practices. From their infamous COINTELPRO program, where they illegally targeted civil rights leaders and activists, to recent revelations, like their role in hiding Nazi war criminals after World War II and the Beverly Hills safety deposit box scandal. The FBI's actions have eroded public confidence. According to declassified FBI files, Operation Paperclip brought Nazi scientists into U.S. government programs under the guise of national security. Meanwhile, the Beverly Hills scandal saw agents seize $80 million worth of assets from private safety deposit boxes without providing evidence of wrongdoing, a move later deemed unconstitutional by the courts. These examples reveal a disturbing pattern of abuse and selective enforcement, often protecting those in power while targeting the vulnerable. This brings us to cases like Luigi's. The media paints him as a criminal, but let's take a step back. The alleged Methoda 3D printed gun seems overly simplistic for someone with Luigi's education and resources. A man from a wealthy family, top of his Ivy League class, and with access to cutting-edge knowledge, why would he choose such a crude method? there are countless more sophisticated options, such as directed energy weapons or resonance frequencies, that wouldn't leave a trace. Could this simplicity indicate a setup? And if Luigi's target was a CEO tied to policies that have harmed millions, including the opioid crisis, could his actions be viewed as resistance to a corrupt system rather than a simple crime? Let's also examine those prosecuting Luigi. Manhattan District Attorney Alvin Bragg has faced significant criticism for his prosecutorial decisions, which some argue are politically motivated. Bragg's track record includes controversial cases like the prosecution of Daniel Penny, which ended in an acquittal, and calls for his resignation, and the pursuit of charges against former President Donald Trump cases that legal experts have described as weak. Financially, Bragg's campaign benefited from significant donations, including $1,001 million from George Soros to the Color of Change PAC, which supported his election. Such financial ties raise questions about external influences on his decisions. This pattern, where political and financial motivations outweigh justicely, adds to public distrust in the system. Another critical piece is the government's recent push for laws branded as anti-Semitic protections, but with troubling implications. For example, large donations from lobbying groups like AIPAC have coincided with legislation imposing disproportionately harsh penalties for speech or actions deemed critical of Israel. While combating hate is vital, these laws often blur the lines between legitimate criticism and criminal behavior, chilling free speech. According to public lobbying records, donations in the millions influence these outcomes, creating another layer of distrust. Historically, when governments align laws with influential donors rather than public interest, public sympathy for their officials diminishes. The deeper question isn't about one man's actions, but about the system itself. Why are regulatory agencies allowed to take funding from the industries they're supposed to oversee? Why isn't every scientific study fully transparent and available for public scrutiny? And why does our justice system protect those in power while prosecuting those who dare to resist? It's time for reform. It's time to demand transparency, accountability, and an end to conflicts of interest that put profits above lives.
Trust the science. We can only trust science that's transparent and scrutinized. The FDA's cozy relationship with Big Pharma, the FBI's history of corruption, and the government's bias against its own people have eroded that trust. It's up to us to hold them accountable, to demand better for ourselves and for future generations. Together, we can shine a light on the system and push for the change we so desperately need.